Sorry, everything okay? I think we just recorded. Okay. But just working with all of our partners here on the call, we wanted to make sure we take this time, because we think it's really important to communicate out the current situation, any changes in guidance and recommendations as we approach the summer and what to anticipate for the fall, because there's ongoing changes that happen. And we do recognize, COVID along with other respiratory viruses, we understand that it still, it still has this ability to harm those that we care for, right? But we also know that there continues to be vaccines and continues to be treatment, but these things change depending on the changes in the viruses themselves. So from a position of preparedness and making sure that we're working together as a team, we wanted to be able to go over where we currently are specific to COVID-19 going into the summer and what to anticipate for the fall, where we are with COVID-19 in terms of the situational awareness and where we are with changes in guidance for the vaccine, along with what to expect this summer and what we can do about it and what we would recommend, and then what to anticipate in the fall. And so we hope that this call will sort of level set, providing that level of situational awareness and recommendation. And come the fall, we hope to reconvene to be able to communicate out in this manner as well, to make sure that there's a space for that communication and to also make sure that there's a space for conversations and questions and clarifications if needed. So why did I go ahead and start with this situational awareness? Now, this was prepared by our Maine CDC's team, and it uses information from both Maine CDC as well as from US CDC. And what you see here, if you haven't seen this graph before, is that week to week, we track the changing variants for COVID-19. And so I want to bring your attention to the gray bar. It was like a gray blue bar. Now, we continue to see new COVID-19 variants emerging throughout the year. And you might have heard about something called FLIRT. And that is what you're seeing in that bluish gray bar, is that week to week, it's gaining speed. And it has this name that we're calling FLIRT, which is, yes, it's a cutesy nickname for two recently identified variants that have shown up in recent months and is likely fueling cases that are happening now in a possible summer surge. Next slide, please, Maureen. And so what you see here, now this is a graph that shows and forecasts and models what we believe will represent a summer surge. So essentially, we often see two surges of COVID-19 activity, and we've seen this in the last 4 years. One in the late summer, early fall, and then the other one in late December, early January. Now, infectious disease modeling from a few weeks ago suggests that we may be in for the same thing this summer. And so what you're seeing here is that in red is wastewater calibration, and the model is in green. And then you see this new FLIRT combined variant, and you can sort of see it starts to take off based on this model and what we're forecasting. Next slide, please. All right, so this is what we can do about it, and this is what we're recommending. And you probably have heard about this already from the different communication routes. Now, COVID-19 vaccination recommendations for adults 65 years and older. What's recommended, well, let's start with what we know, which still remains the same. Older adults are the most vulnerable to severe illness from COVID-19 infection. A large proportion of our hospitalizations and deaths that have occurred in the last year were among those that are age 65 and older. This is the situation nationally. This is the situation regionally. This is the situation here in Maine. And this has not changed. And so even though we are in a better place with respiratory illnesses and with COVID-19 because of the availability of vaccines and treatment, we know that our vulnerable population still remains the same. And that's who we want to protect. Now, with COVID-19 continuing to circulate and protection waning, again, very much the same givens. Among this age group, we are asking you to help us encourage our residents in long-term care facilities, including in nursing homes, and also among your staff that are 65 years and older to receive a dose of the updated 2023-2024 COVID-19 vaccine and get an additional dose administered 4 months, at least 4 months after the initial dose from the 2023-2024 season. What does that mean? It means that if you haven't received, or if the individual you're caring for or your staff hasn't received the 2023-2024 COVID vaccine, we would still recommend that you would get that now, okay? Given we are expecting a summer surge and we're starting to see that take off in certain states. Now, this additional dose, what it also means is that if you or the person you're caring for or your staff received the vaccine, this 2023-2024 vaccine, more than 4 months ago and you're 65 years and older, it's recommended that you get an additional dose. Okay. I do want to make one other clarification because we did get this question. Someone asked, does this mean that you have to get, if I'm 65 years and older, I got my dose 5 months ago, right? My first 2023-2024 COVID vaccine dose. And that was 5 months ago. And I get another dose now. Now it makes me up to date. But does it mean that I have to get a dose, an additional dose every 4 months? No. It means you get the 2023-2024 vaccine, and then you get an additional dose 4 months later or more. So it's not every 4 months. And so I wanted to make sure we were clear on that. Now, the other question that's coming up that we're hearing among folks is, although a new COVID-19 vaccine will be available for the 2024-2025 season, and we are expecting that, we still encourage people to stay up to date and get vaccinated now, because what I just showed on that prior slide is that we're expecting a summer surge. And we're seeing that this flirt variant is really, really good at spreading. Next slide, please. Okay. Now the other update I wanted to provide you guys was this Bridge Access Program. The Bridge Program was a program that was stood up by US CDC to help folks have access to COVID-19 vaccines. And these were the folks that were uninsured or underinsured, meaning their insurance were out of, if it was out of network, it may not cover. Now, for those that are uninsured and underinsured, they would have access to the vaccines without cost to the individual. But on May 9th, 2024, the US CDC announced that it was much earlier than anticipated, but that the end date for the Bridge Access Program will be much earlier than anticipated and will likely happen sometime in August of 2024. Because of that, so that's August, that's going to be in about 2 months, right? What that means, though, it means that if you are uninsured, you will now likely have to pay out of pocket, right? There will be a cost associated with this vaccine. If you're underinsured, there's also a possibility that there will be a cost associated with this vaccine. And so what we're asking, and this is just to think strategically, is that we're urging staff and their families who may be underinsured or uninsured to get vaccinated now while this vaccine is available to them at no cost. And that should provide protection, for this anticipated summer surge for sure. This message is for everyone. So anyone who's uninsured and underinsured, it would be good to get it now while it is not associated with the cost to the individual. instead of waiting till after August. Next, please. All right. Now, what I'm showing you here on this graph, this is what we track here for the state of Maine, and it looks at the number of COVID-19 vaccines administered for this 2023-2024 year. We are continuing to see COVID-19 vaccines given across the state, but what you'll see here, you see how it sort of plateaus, you know, it just goes up and then it just sort of becomes flat, that plateau. What that tells us is just that the numbers are starting to slow down. It still goes up. We see the numbers tick up every week, which is good. People are still getting vaccinated. It's creeping up slowly. And we didn't really see a bump in that trend after CDC recommended that an additional dose for older adults. That, you know, when CDC recommended that additional dose for older adults, we were hoping to see a bump, but we really didn't see a bump. And that's concerning. Next, please. All right, now the next few slides, we'll talk about, well, what about long-term care facilities and nursing homes? How are we doing there? And all this data is from US CDC. Now, what you're seeing here is a map of all 50 states, right? The darker the blue, the better. It means that there's more people that are vaccinated. Let me make sure if you can see that. I hope you can sort of see that. So for example, this is based on the up-to-date definition, right? And that means if you're, 65 and older, you have received at least one dose of the 2023-2024 COVID vaccine. And, after 4 months or more, you receive an additional dose, right? That makes you up to date. The darker the color, the better. And what you see here is that Maine is a little bit light, right? It's lighter than what we would like. And what that tells us is that here in Maine, nursing home residents in Maine, fewer than 1 in 3 are up to date with their COVID-19 vaccine. And this is indeed lower compared to other states in the Northeast region. Next, please. Now, what this shows us is staff. So what I showed earlier were residents, and now I'm showing staff, percent of nursing home staff that are up to date with COVID-19 vaccines. I know across the US, we've had difficulty with this in getting our staff up to date with the vaccines. We saw this difficulty and challenge early on in the respiratory fall season and even up till now, right? So what does this tell us? You can sort of see Maine up in the Northeast there and still much lighter than the rest of the other states in our Northeast region when you're looking at Vermont, Massachusetts, and New York. So among nursing home staff in Maine, very similar to the other slide, fewer than 1 in 3 are up to date on their COVID-19 vaccines as well. Again, this is a bit lower than much of the Northeast and similar to a lot of the country. Next, please. Now, I wanted to talk a bit about what to expect this summer as well as the fall. So this slide here speaks to that a bit in terms of planning for the upcoming respiratory season. We usually talk about the fall and winter as respiratory season, but keep in mind that COVID-19 circulates year round, and it's fairly likely that we will see some surge activity later this summer for all the things I just mentioned earlier. And this summer or even potentially early fall. So because of that, we still think it's incredibly important to share this message of trying to get that vaccine, staying up to date with your vaccines now. Immunizations really still remain the best protection against COVID-19 and also for influenza and RSV as well. And then for nursing homes that want to be able to offer that protection with the fewest barriers to access, because I did mention that the Bridge Access Program is ending in August, this is a really good time. It's actually a great time to start working on buying vaccines now for COVID-19, influenza, and RSV. Next slide, please. All right, so what we are asking is please in order to protect your staff and residents, we strongly encourage you to please continue to offer the COVID-19 vaccine. And this is the 2023-2024 COVID-19 vaccine at your facility to those who have not yet received it, as well as that additional dose to those that are 65 years and older. Because likely, if the push was sometime in November, October, November, December, they're due, if they're 65 and older, they're due for their additional dose right now. And please continue to offer the updated 2024-2025 COVID-19 vaccine at your facility when it becomes available. And we will keep in touch and we'll communicate likely how we're communicating now before that fall season again. We continue to strongly recommend COVID-19, flu, and RSV vaccine to all residents. And we, as you saw, it's not just about our residents, it's also about our staff. So please help us encourage staff to stay up to date on vaccines recommended for healthcare personnel. And please let them know that now is a good time to take advantage of this Bridge Access program before it expires in August. While the access is still easy and free for those that are uninsured and underinsured. And also, if you don't mind, could you also please remind staff that by getting vaccinated, they're helping protect the residents and patients they care for. Now, I'm going to pass this off, I believe, to
Dr. Va?
Yeah, go ahead.
There's a question in the chat, and it
I
says,
missed it. Okay.
Can you discuss the difference in numbers of death from COVID as it compares to the flu?
Yeah, absolutely. So, right now what we're seeing, and we started to see this early, probably, I want to say, into like the fall, winter, into now, and flu season just ended. And right now what we are seeing is that, for the general population, COVID-19 it is becoming, in terms of morbidity and mortality, it's similar to flu, right? It's more so similar to flu. But again, among those that are 65 years and older, the numbers still remain high. I don't have the exact numbers in terms of proportion, but we do track it and I can get that for you. But it's still, among all of those folks that, do get sick, and among those that get sick and die, there's still a huge disproportionate of folks that are 65 and older that are impacted the most. I will get you those numbers though. Oh, thank you, Maureen.
Yeah, that's for the bridge. There was a question for where to get the bridge access, so I just posted that in the chat. Any other questions for Dr. Va before we turn it over to Nicole for a ambassador update? Okay, Nicole.
Good afternoon, everyone. Thank you, Dr. Va and Maureen. I'm just here to provide a brief update on the Power of Care campaign. I'm going to just provide a little bit of an overview, but I'm sure this is repetitive knowledge for many on the call. I do see a lot of my active ambassadors on this call, so that's great. So the Power of Care is focused on providing education about the importance of vaccination for both COVID and flu. And this project is also being done in collaboration with Maine CDC and, of course, Maine Healthcare Association. And we utilize social media. So Ethos Marketing develops all the social media. So you see that on Facebook, Instagram. They utilize those channels. And also they have a landing page where individuals are directed to have frequently asked questions. Also, these webinars you see that are being recorded and frequently done are posted on there to provide updates. And also, if there's a question on there, if someone has a question and it's not located on the landing page, individuals can text a number and we're able to get that question answered through our resources, such as Maine CDC and the Maine Healthcare Association and partners. I'm going to drop the landing page website right in the chat, so you have that available if you do want to look at that, if you have not done so thus far. All facilities have received or should have received toolkits and continued education toolkits. The spring card went out. There's a Valentine's card that went out. And hopefully for the summer, we'll have some new updated information that will be coming to facilities as well, to kind of keep that information fresh. So all the information that's developed is utilized in social media, but also we have something called the ambassador. And these facility ambassadors can also help carry that message with developed material through Ethos that facilities are getting, even if they don't have an ambassador, but that ambassador is signed on with us to help carry that message. They do receive a $100 monthly stipend for carrying that information among residents, staff, and family members to really vocalize the importance of vaccination for both COVID and flu. Ambassadors can be ICPs, infection control preventionists, CRMA, CNA, social workers, activities directors, anyone that's really interacting with residents, family members, and their staff members and their peers throughout the facility. It has become more of a natural fit for infection control preventionists because they're already providing this education, but these are just additional tools that they can utilize. One of the biggest benefits that I think the ambassadors have found to be, and for us as well, is that direct communication, because we do monthly check-in calls, we do a monthly check-in form, so we can continue to communicate on what barriers are being seen, what hesitancies they are facing within the facility, so we can help overcome those with our partnerships with the Maine CDC and the Maine Healthcare Association. So those have been incredibly useful to continue that communication. And just ambassadors that are carrying that message are doing amazing things. They're implementing those materials in care plan meetings and orientation packets for new admissions and for staff. So it's been utilized in many different ways. They're putting it up on LED lights in front of their facilities. Facilities are also sharing the Facebook post from Ethos for the Power of Care on their own facility Facebook. So family members or anyone that's searching those facilities are also seeing they're actively participating in the Power of Care campaign. Just a lot of amazing things that are being done to implement those materials. So that's really the update I have. We're still actively recruiting ambassadors. So if you are interested or you have someone in your facility that you feel would naturally take on this role, we do an orientation with the ambassador, and then we help provide materials throughout the process and have active communication as they are serving as an ambassador to help, like I said, overcome barriers or hesitancies that are being reported in those facilities. And I can drop my email right in the chat.
Thank you, Nicole. I think Dr. Va just put in the chat an answer on the question of death. So
yeah, you know, hi, Maureen. I absolutely did. I just want to clarify this for folks on the call too. You know, what I put in the chat was like over the last 12 weeks, we had 33 deaths, where almost like 88%, close to 90% were among those that were 60 plus years. You know, there's been this, you know, US CDC has showed that the death rates, you know, for COVID is almost on par with flu. But I do want to clarify that because that may not be a good comparison, right? Because flu is very seasonal. We know flu starts between like, you know, September to May, or I'm sorry, you know, October to May, right? Whereas COVID is ongoing with multiple surges throughout the year. So even though the death rates may be approaching that of the flu, when you put that in numbers and the duration of time of just transmission, ongoing transmission with these multiple surges in a year, the numbers are actually much higher. And I want to make sure we all recognize that too. Even though the death rate itself is on, you know, close to being on par with flu, when you apply that to seasonality and how often and how much spread there is, COVID still spreads much more for longer with more surges. And so that translates to more numbers actually.
So we just want to open up this call for any questions, comments. Feel free to come off mute. It's a great time to get any questions answered that you might have. Yes, Dr. Wireman.
Thank you so much. Just it seems like, and you probably have data about this. It seems like our onset of flu has been later and extending more later into the spring. I mean, I think it was definitely more that February, March, April that we saw it in a lot of our facilities. And just wondering about the timing of administering the flu vaccine. I often see people getting it in September and early October, and just wondering if it would be advisable to think about shifting more October, November, just trying to, I don't know, trying to time it with when we're actually seeing the flu in the community. And I know that probably varies year to year, and I'm probably being anecdotal, but that's what it felt like this past couple of years at least.
Yeah, and I really appreciate that, because what I hear in your question, Heidi, is that, can we be more strategic, right? Depending on what we are anticipating to see. And I like that. Now, in terms of like, do we see it later? You're right. It's hard. It varies. I know, like, for example, this season compared to last season, did extend much longer. It was interesting. This season was more like it started later, and then it went on longer, right? Whereas last season it was more of like this, almost like a quick spike up and down, much quicker. But you're right, that's year to year. But understanding that, we do see it travel globally, right? And this is how we also anticipate like what the vaccine makeup itself. And with that in mind, some of the things that we do want to consider is just that strategy, what we're anticipating, what we're seeing globally. Would it be better to start messaging and providing that early on, or should we delay it to later, to your point? In addition to that, I do think now, because there is indeed, RSV to consider, as well as COVID-19 to consider, do we message it as a bundle, or do we want to, like, based on consumer fatigue, right? Do we want to try to roll this out in a more a smoother way, where it's not all at once? And those are things all to consider. I actually don't have an answer right now for you, but I know those are things that we at Maine CDC, I know working with Maureen and the team here, as we think about strategy going into the fall, we'll have to think about all those components. So I appreciate that question very much.
Thank you for your reply. And then I guess maybe, since I've got the stage right now, on the RSV side, and I will confess not to having looked at it recently. Dr. Marino is off today, so he is the one who keeps up on all this sort of thing. A lot of the data from the RSV vaccine, at least initially, showed reduction in symptoms as opposed to reduction necessarily in hospitalizations and more significant outcomes. And so we've been pretty targeted with who we are suggesting the vaccine to, simply because of vaccine fatigue, and thinking for a lot of people, the flu, the COVID, that's really where the money's at. Are we seeing any evidence, as now we've had the RSV vaccine for the past year, that it really is reducing hospitalizations for and deaths for RSV?
Hi, I'm so sorry. I think I might have missed that. Did I hear that? Can you repeat like what the strategy was in terms of like offering RSV vaccine? Because I heard that you were very strategic about it.
So we were strategic about who we encouraged to get the vaccine, because of prioritizing flu and COVID and kind of vaccine fatigue in general. And so targeting people with, COPD, really high respiratory risks. And so, I mean, anyone can have it, but those were the folks that we were particularly targeting to get the RSV, as opposed to like with the flu or the COVID saying everyone should get this. Out of concern that people are just like, that's too many vaccines, because we're definitely hearing that a lot.
Got it. I understand now. And you want to know whether or not there's evidence that it does indeed, instead of reducing just symptomology, right? Is that what I heard? Does it reduce hospitalizations as well? Yes,
Yeah,
it does.
hospitalizations and death, like.
I understand, and deaths as well. CDC actually put something out in terms of like RSV immunization, and I want to say it was an MMWR, where it does indeed show effectiveness. Let me try to find that link and put it into the chat for you. Okay.
Thank you so much.
The other person that we do have some people from, at least one person from licensing is also on the call. So if you have questions that are directed more towards licensing, feel free. There's Lynn Hadiniak is on the call. Lynn, do you want to introduce yourself?
Sure. My name is Lynn Hadiniak. I am the Associate Director within the Division of Licensing who oversees medical facilities, which would include nursing homes and multi-levels. I don't oversee assisted housing, but I can put you in touch with someone who does, if that is your question. The very first one, what changes are there for assisted living facilities? As I just said, I don't oversee those, so I'm going to either refer to Dr. Va's previous statements about congregate living in general, and also advise you to reach out to my peer, Heather Hyatt, or her program manager for assisted housing. Her name is Nicole Gwinnett.
Other questions for Dr. Va? Dr. Va, if you want to, when you find that information, if you want to send it to me, I can send it out to all the participants as well.
Thank you. Hey, Lynn, I was wondering, sorry, I'm multitasking. I was trying to also copy and paste some of the links here.
Mhm.
But while I do that, Lynn, did you mention, because this is, I was on a conference with the US CDC recently, and I just gotten back. And one of the things that was mentioned was, are they still this language in terms of like, we still have to offer both flu and COVID vaccines, correct? To
Yes.
staff and residents. Okay.
Yes, I don't remember the exact date that requirement ends. And I would definitely look it up if I can get back to you on that, that would be great.
Yeah, and it's my understanding that it did not end.
Ever? I think I'll double check, Dr. Va.
Yeah, please double check. Thank you.
Yeah, incorrect, wrong information, right?
Other things that people want to talk about or ask questions, now's a great time to do it.
Hi, are we able to talk here or do you want everything in the chat?
No, go right ahead. Talk,
Okay, great.
please.
So I'm assisted living. I know, Lynn, thank you. Heather Hyatt's actually my surveyor, so I have all of her information. I think for me, this was totally useful to hear about the summer surge and how Maine's a little bit behind with ensuring that our residents and staff, I've been the administrator for 17 years, are, up to date on vaccinations. I am looking for some guidance, and I don't know in general, since you do nursing homes, about, we had a lot of things put into place for us when COVID began, like doing fit tests have to be done annually if you're over 40, having to keep so many in-house. And I just am wondering, like, how much of this regimen we're supposed to still be doing without making it seem that it's not important. It is a lot. I'm a 7-bed, so I'm the girl who is here on this and taking out my trash at the end of the night. So
Yes, I don't know what the assisted housing world is doing or is requiring, so I would have to refer you to Heather.
could you tell me, is there still a lot of, like, do all workers have to be fit tested still at the nursing home level and follow all those guidelines still that were initially put into place?
Anytime the PPE of a N95 is used, it must be used within the testing period the person has last been fit tested. So in other words, yes, they do need to keep up with their fit testing to ensure that the N95 masks fit appropriately.
Sure, got it.
And if I'm correct, I think some of those that guidance comes from OSHA. And maybe I can see if I can find some of that for developing your respiratory protection program.
Yes. Thank you, Maureen. That is correct.
I know there's a lot of resources on the Maine CDC website for anyone who is a member of American Healthcare Association or National Center for Assisted Living. They also do have a toolkit for respiratory virus. So those are other great resources for people. Dr. Ba, is there anything else you want to discuss today?
No, you know what, I think this is we wanted to check in, right? To make sure that we updated everybody on what we currently understand and what we know right now. And just because we also understood like there's this importance for another push, right? But you guys all know this, right? But sometimes when you don't hear about it, I do recognize it's when it's not in the public space that it may seem as if things are okay, which for most of the population, it's okay. But in a sense, our job is to protect those that are most vulnerable. So that still remains the same. And what we're starting to understand now is what does COVID look like for us year to year. And we are seeing this sort of like two surges, right? Like during the summer and the fall. So it's good for us to continue to communicate this. So that it's more routine. That's what I'm trying to get at. Like, this is more of a routine approach to how we manage respiratory illnesses, including COVID, now that we're starting to understand what the pattern for COVID is and who the highest risk people are. I am putting some links about RSV vaccines, and I do understand, the question earlier in terms of like, who is at most highest risk. And I agree, Heidi, like you mentioned that, you focus on those that had existing comorbid conditions that would put folks at higher risk for morbidity that could lead to hospitalizations. I thought I saw a recent MMWR, but it actually wasn't recent. It's still all the same studies that were used at the ACIP meeting. And I am putting that link here. But I do understand there are newer studies that did just recently come out, but it's based on modeling. So it doesn't answer your question, like, do we have, strong evidence to show that it reduces hospitalizations and deaths? Based on modeling, possibly. But if anything, it does show that it reduces morbidity, to Heidi's point, and only among those at high risk. Thanks, Maureen.
Again, any other questions? If people feel free to come off mute and ask any questions that you have. Dr. Barr, so I assume we'll probably have another similar meeting like this as we get closer to fall, or in the event there is a major summer surge that you would want to have some communication with people.
Absolutely, that's correct. Yep. If anything, please continue to push out the vaccines for those that are not yet up to date. And now I hope folks are clear on what up to date means for those that are 65 and older in terms of that term additional dose. And if we are able to protect our folks, then we shouldn't, even if there is indeed a summer surge, hopefully we can reduce morbidity and mortality among the folks that we care for. But what to expect is if there was something that happens that's out of the normal, we will definitely reconvene and let you guys know. If not, we will reconvene anyhow before the fall season, just to reiterate, what the vaccines and treatments, in case there's any changes, but definitely what vaccines and treatments are available come the fall respiratory season. But thank you so much, Maureen.
Yeah, there's a really good question in the chat from Deb Barubi asking about Bionex tests. Now that those are no longer being sent, is there going to be any option in Maine to get those? Does anyone know any updates on that?
Let me make sure I understand. How were those provided before or now?
So previously, I guess it was through the federal government. I'm not sure if someone else wants to jump in. They were sending them out, and that has stopped now, I believe.
Yes, that's correct. Right. I now I understand. You're talking about the program where the US sent out expired tests and you can tell whether or not they're still viable, even though they were expired. Because I received some. Those?
No, these were boxes. We got big boxes in most of the time. Hold on a second. Well, I won't try to find the box of them, but we would receive them, and then we'd be able to use those for testing. And looks like some of people are still receiving them. And then we got at least an offer here of someone who says they've got extras.
Mhm. This is Amy Richard. They stopped, like, our facility was getting a bunch through that program that Maureen's speaking about. And now you have to go on and request them. And you still get, like, each individual can, so per household, like, so I've actually been able to request them from my own house. I've been bringing them up to my facility and then requesting them from each of my residents because they are so expensive and I have a lower income group. So there is a way you can request it. I think I just Google it.
I think I might have a link for that too. I will look and follow up on that.
Yeah, hey, Maureen, is that, so this is through the federal, is this through CMS or I guess I'm not familiar with this program.
Yeah, I think it's through I think it is through CMS or HHS, as somebody put here. I know there is an email for that.
Okay, I'll also ask and see
Okay.
as well. Yep. Oh, and I actually put in a link. I did find a more recent study that was just published in April of this year in regards to hospitalizations, RSV hospitalizations and deaths.
We are seeing that there are still a lot of centers that are still receiving the Bionex on a regular basis. So that's great news. Anything else that people want to talk about before we end today's call? Dr. Va, do you want to end the call? Say anything more?
Just thank you, and more to come the fall. But you'll hear from us sooner if something just does not go well. Thank you, guys.
Thanks, everybody. If you have any questions, don't hesitate to reach out to us or to the Power of Care at any time.
Thank you.
Have a great day. Have a great summer.
Mm.